TGIF, the doctor is in, as he is every Friday. Dr. Robert Tiballi, an infectious disease specialist with the Catholic Medical Association, is here to answer your coronavirus questions. Hi, doctor. I wanted to ask you first about a study published in the journal Nature Medicine. It says the antibodies coronavirus survivors build up could fade away. So does this mean you can contract COVID-19 over and over again? And is there no point in getting the antibody test?
Well, it's a very deep question and very interesting question, one that we'll understand more as time goes on. There was a patient, I believe in Texas, who seems to have her second naturally acquired coronavirus infection here in the US. Uh, and it may be that the antibodies are not persistent, that they may not be long-term protective. However, there may be a memory response that when you're exposed to a second case of corona, or second exposure, I should say, that you may perk up the antibody response at that point. But it remains to be seen. It's not a point that's clear at this time.
Okay. A team of European scientists found that people with type A blood are 45% more likely than people with other types to get the virus. What are your thoughts on that? Could our blood type actually play a role in our risk of getting infected?
Well, again, another interesting observation. This was pointed out in Chinese patients also, and it appeared that type O blood was actually protective. When you talk about type A, type O, type B, there's certain antigens or protein that sticks out from the red blood cell. This may be associated with other characteristics of the blood type. We're not all the same. We all have little minor differences in our blood cells, and it may be that people with type A might be more susceptible or resilient to things that could happen with the virus, like development of the blood clot syndrome that we're talking about. We'll probably find someday that there's a defined risk factor with some antigenic component to blood or a person's genetic makeup that makes them prone to getting clots, like the blue toe syndrome, the COVID toe, the other clotting that we've been talking about. But it's a very interesting observation, but we're not ready to act on that and tell people with type A or type O blood, that you're going to get sick or you're going to be well. So, but it's another interesting observation.
All right, I guess time will tell. And all right, I want to get your thoughts on dexamethasone. Researchers at the University of Oxford say the steroid, which is cheap and available, can save the lives of people seriously ill with COVID-19. What do you think of this drug?
Well, the dexamethasone is a potent anti-inflammatory commonly used in patients with brain tumors to shrink the swelling in the brain and other types of inflammation in the body. The chief words were, it was cheap and available 2 weeks ago. Now it's virtually unheard. You can't get it anywhere.
Of course.
But it's effective in the late phases of COVID. Early phases of viral syndrome, then there's a period of increased clinical wellness, followed by an immunological response that could make people very sick and cause very severe lung problems. The dexamethasone helps with those people with the lung problems by decreasing the immune response in the lung and the inflammation. So it's been actually life-saving. It's improved the clinical course of about a third of the patients that get it late in the disease with lung problems requiring oxygen or being put on a ventilator. So it's all good news, but it's virtually unavailable right now. Even the hospital pharmacists are telling me they can't get it now.
Oh,
so,
boy. We'll have to get them to manufacture some more. All right, Dr. Robert Tiballi of the Catholic Medical Association, thanks for being with us.
Thank you, and have a wonderful weekend.
If you're watching Currents News on YouTube, be sure to hit the subscribe button and then click on the bell to get instant updates about all of our newest content, because we are putting your faith in the news.